Okay, Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Welcome, dear doctors. Let's start our meeting. Today we'll start about how to prepare for MRCOG Part 2 exam, which will be inshallah in January 2023. There is another exam in September, okay, but our group today is preparing for this is a full course preparing for January 2023 exam. Some doctors with us here are preparing for September exam, so best wishes for you all, inshallah. The attendants today are either doctors who have just passed MRCOG Part 1 or they tried before Part 2 MRCOG exam. For doctors who passed Part 1, I want to reassure them that don't worry, success in Part 2 exam is not that difficult. Although it's the most challenging part in MRCOG, but don't worry, with hard working and studying hard, inshallah you will pass. And don't listen to who say that I will not study, I will just study some recalls, some past papers, and I will pass. And some doctors could do this. Yes, you are right. But doctors who passed without studying hard in this exam, they have a problem. The problem that if you don't study well for Part 2 exam, there will be problem in your knowledge later on. As everybody knows that we study hard only if we have exams. And really, it's very important that studying for MRCOG Part 2 exam give you very good knowledge, which will even change your practice and it will improve much your career. So it's not just passing an exam. This exam is different from other exams, different from diploma, master, whatever. This exam improves your practice, and this exam gives you very good amount of knowledge, which will help you throughout all your life later. So please take it very serious, because it will affect much your quality of life later on, and it will affect much your practice later on. And if you are a doctor who became a member of the Royal College, you know now that your friends, your colleagues will ask you about medical information. You should be a good responsible one, and you should be having good amount of knowledge so you can answer them, because they are expecting specific amount of knowledge coming from you. So you should be responsible for that. So what is MRCOG Part 2 exam? As we know that MRCOG, you should pass through 3 exams. Part 1, then Part 2, then Part 3, which is the clinical OSCE exam. Part 2, as we said, is the most challenging one, which needs longer duration of preparation. But as we said, it's very important. It's the most important one, which will affect much your career and your quality of being a gynecologist and obstetric later on. So we have to take it serious, because it's very important for us. So how the training system in UK looks like? After being graduated from the medical school in UK, you become foundation year 1. Foundation year 1 in the Arabian countries like being house officer. It's composed of 2 years. Internal medicine, dermatology, ophthalmology, different specialties. So it's general year. While for the second year, you become foundation year 2. Sound very low with everybody, or it's okay with somebody? Because if it's okay with somebody, so it's good. Please write on the chat. Unstable. Okay. Thanks for saying. Is it okay with anybody? So after being graduated from the medical school, you are now foundation year 1, which is a general year of training. And in the second year, you become foundation year 2. In foundation year 2, you are still house officer, but you are now a senior house officer. What is the meaning of senior house officer? You are now interested in one specialty. For example, I am foundation year 2, so in this year I work in gynecology and obstetrics only. So now you finished now the foundation year number 2. Then you start the specialized training years, which is composed of 7 years. ST1, ST2, 3, 4, 5, 6, 7. 7 years of training in gynecology and obstetrics. Every year of them, it takes 1 year. So from ST1 to ST2, 1 year, and so on. And to come from ST2 to become ST3, you should pass part 1 MRCOG exam. And to pass from ST5 to ST6, you should pass MRCOG part 2 and MRCOG part 3 exam. So I say 1, 2, 3, 4, 5, 6, 7. Because from 2 to 3, you need part 1 MRCOG. And from ST5 to ST6, you need to pass part 2 and part 3 MRCOG exams. So where are you now? You are now in this level. So the examiner is testing you as if you are a competent ST5 trying to become ST6. So your level is here. You are now as an ST5 in UK. So all doctors in the training system in UK who are ST6 already they passed part 2 and part 3 exam. And this is very important thing to know because some doctors in the exam, they answer the exam in MRCOG part 2 because they are consultants. And this is a big problem. The test is not dealing with you as a consultant. You are not a consultant in the exam. You are at this step, you are ST5. So don't manage the case as if you are the consultant because you will not say the right answer. You are ST5, working in a teamwork under coverage of your seniors and under coverage of a consultant. So it's a very important point for the exam. So some doctors, they say, I solved the exam very, very well, but you solved the exam as a consultant, and the exam wants you to be ST5. Okay. After finishing the 7 years of training, you get certificate called Certificate of Completing the Training. After that, you try to be a consultant with subspecialty to start advanced training subspecialty module to be subspecialized. Subspecialty like subfertility, like gynae oncology, and other subspecialties. Okay, so this is a training system in UK, and we are in this course, we are talking at the level of ST5, trying to become ST6. So all ST6, they passed part 2 and part 3 exam. So it's not something that is very difficult. No, it's not. All ST6, they passed part 2 and also they passed part 3 exam. But we know part 2 is the most challenging because it's the one that will give you lots of information. Part 1 and part 3 are easier. So once you passed part 2, alhamdulillah, you passed most of the challenge. What is remaining? Only part 3, and it's not difficult. It's like a role playing that you are trained to do, so you can pass, inshallah, part 3 and become member of the real college. After being a member, you can register yourself in the General Medical Council and you start to find a job in UK. Okay, so how we can pass part 2 exam? Voice is okay, right? Okay. So how we can pass part 2 exam? Passing part 2, as we said, it needs hard working because you will pass through many guidelines, green top guidelines, noise guidelines.
and many articles from the TOG magazine, and also other guidelines about HIV from Behavior website, other guidelines about infections from BASH guidelines, and other guidelines of contraception through Faculty of Sexual and Reproductive Health. And this is a challenge in part two, too much knowledge and many sources. Which one is important? Which one is less important? And there are also other sources like Stratog, which is the e-learning website from MRCOG. So this hardworking can be easier if you have system you are passing through. And try to take others to pass with you. Please, please, please don't go through this way alone. Alone, it's very difficult. Okay, be in a group, have a study partner. Okay, and we will learn in this course, inshallah, that the best thing, the most important technique to learn is to teach others. To teach. When you teach, you remember more than 90% of what you say. When you just attend a lecture, you can remember only 5 to 10% of what you hear. So try to teach others. In addition to being something helpful for you, it's also a sawab and something good, as you know. Okay, so in our course, how we will do it? Okay, number one, we have long course made of 40 online live webinars. These 40 online meetings, every one of them takes about 4 to 5 hours. We'll cover everything, everything. I mean it by word. I mean that you don't need to open any guideline. After that, we start to have another summarized crash course to summarize the most important point, to solve many questions. And it's very helpful in the last months before the exam. In every topic we study, we solve its questions. Okay, doctor, from where I'm going to study? From the guidelines? No, from the PowerPoint library and the video library on my website, OSAMAAKL.com. So every topic, it has its questions. And also there are mock exams in the last months before the exam, extremely helpful. Okay, you solve the exam, it gives you a result, it gives you a score, and it tells you what are the points of weakness and which questions you should have done better. So you may think it's expensive. No, it's not, because it's excellent cost benefit. Okay, you can have cheaper courses from other sources. Okay, but the benefit is most important. I understand very well how it's something very distressing not to pass through an exam. That's why we take it serious, as we said. So most of you are preparing for January 2023 exam, but we have a coming exam in September. So what are the steps of booking for the exam? Number one, expression of interest, which is a perform. You need to fill it on the website of MRCOG. You enter your name, your email. Okay, so they know that you are planning for the next part 2 exam, so they prepare a place for you. Doctors who will have the exam in September, they should have filled the expression of interest by 6th of May. Okay, and already it's closed in 1st of July. Then booking the exam will start after about 2 weeks, and booking the exam will stay open about 8 days and 1 month. Then they will have the exam in Tuesday, 20th of September. Then about after 1 month, the result of the exam appears. It always takes 1 month for the result to appear after the exam. Always the exam for part 2 is on Tuesday. Always exams for part 1 on Monday. So how the exam looks like? Is it paperworks? No, it's computer-based program. Computer-based. You go to one of the person view centers in your country, and in most of countries, there are many centers for person view. You sit on a computer, they open it for you, and you start solving the exam on a computer. It's much better than paperworks. Okay, because there is no chance to miss a question. And there is no chance that you made a mistake when you transfer the answers from the question sheet to the answer sheet. My exam was paperwork, okay? But now the exam is computer-based, which is much, much better. Another advantage, let's say I reach late to the center. Don't worry, they will open the computer for you and your 3 hours for the next paper will start when they open the computer for you. So it's something good because in written paper exam, if you came late, you miss some of the time. There is nothing like that in computer based. So if you tell me that I am not used to study using computer, I am sorry, you have to be trained for that. Okay, so studying from computer and from mobile or laptop, whatever, is better because now already the exam itself is computer based. And also because studying from online sources is more updated. If you have a book and you got it since 6 months, for example, a book containing the guidelines and you will study from it, I am sorry, it's not up to date now because there are two guidelines, two RCOG Green Top guidelines published since 4 months. They are not present in this book. So any book, I consider it out of date. And even when you try to solve questions from books, try to get the books which were published within the last year, then within the last 2 years, then within the last 3 years. So start from the most up-to-date. Okay, so any written source is out of date, even if it was published a few months ago, because it missed already some guidelines. What is the cost, financial cost of the exam? This is a financial cost of part 2 exam because part 2 exam Jan 2023 is not published yet on RCOG website. If you remember from part 1, it depends upon your country. Is it band A or band B or band C? Most of us are band B, so this is the cost of the exam. And we need to pass the exam from the immediate coming trial. We don't want to try multiple times. We need to pass from this coming trial, inshallah. Okay, so what is the exam made of? It's made of 2 papers. Okay, let me say papers, although it's computer-based. Okay, we can say 2 sessions to be more accurate. Okay, first session is 3 hours. In these 3 hours, you solve 100 questions. These 100 questions, 50 question single best answer, and 50 question MQ. In single best answer, same like part 1. You have a question and they give you 5 options and you choose one of them. This is single best answer. So what is MQ? It's more challenging pattern of questions. And the advantage of this MQ, it reduces the chance of choosing the right answer by luck. So luck is not helpful with MQs. It's helpful with single best answer because with single best answer, already every option has 20% chance of being the right answer. But in MQ, if there are 25 options, the rule of luck now is only 4%. In MQ, at first, he starts by giving you too many options. Okay, then he gave you the questions. For example, 3 questions, and you say question 1, its answer is option E, question 2, its answer M, question 3, its answer is option O, for example. So it's more challenging, and we have techniques how to solve it easily to make it like single best answer. So we have paper 1, then paper 2, every one of them 3 hours, every one of them it has 50 single best answer and 50 MQs, and then in between you have a break which is 60 minutes. And this break is flexible in the computer-based program. So if you want to start second paper after 40 minutes, okay, you can do that. But I recommend that you take your full break because After solving first session, already you feel tired, exhausted, and you spend already 50% of the exam. So you have to take a good restart moment so you can solve well or even better in the second session, because you need to pass in both of them with a good mark, inshallah, to make it easy to pass. So what was the feedback and outcome of the previous courses? Alhamdulillah, throughout the last 6 years, I could help many doctors. And I know that in the photos, you know many of them, okay? Alhamdulillah, I helped hundreds to pass this exam. I will not take much time in showing the photos about doctors who passed, but I started since 2016. Okay, alhamdulillah, many, sure, some of them with you in the hospital, some of you already are your friends, and inshallah, you will follow them one day and you will become a member of the Royal College and you will attend the ceremony for sure. For sure, you will do that. For doctors who didn't pass this exam before, I have a belief. This belief is that doctors who passed this exam after more than one trial, they have knowledge better than doctors who passed from the first trial. Because doctors who passed after one trial, they studied more than once. Their knowledge is much more fixed in their memory. On the long run, in their future, I believe they have more knowledge. And doctors who pass the exam without studying very hard, they have a problem. They need to study again to pass part 2, to pass part 3 exam. So please study part 2 very hard for your future. To pass easily in part 3 exam, please take it serious. It's very important. I know that it can be challenging to save time and to prepare well for this exam, but this is important. Consider this one of the most important projects in your life, not just passing an exam. Okay, so we have 40 meetings and not weekly exam, we have double weekly exam. So after attending the lecture and we solve some of the questions present in the PowerPoint, already you find on the website a full quiz about this topic. You solve it and you take a score and you can solve this quiz more than once until you get 100%. Do you have a schedule for the 40 sessions? Yes, we will come to it now. It's in the coming slide. Here is it. So we have 2 weekly meetings on Tuesday and Friday. Tuesday 1 p.m. and Friday 10 a.m. Egypt time. In UK time, it's 12 p.m. and 9 a.m. Same like today. Today is Friday. We started already 10 a.m. Cairo time, 9 a.m. UK time. Every meeting of them takes about 4 hours. And there is a small break in between, and maximum it can take 5 hours. In every day of these scientific days, we study either one big topic, because some topics are large, like intrapartum care, for example. It takes even 2 scientific days, not only one. And some topics, in some days, we may discuss more than one topic. So these are some of the topics that will be discussed throughout our course. Okay, to take an example, systemic lupus, phenylketonuria, diabetes, DKA with pregnancy, early pregnancy problems, including molar pregnancy, ectopic miscarriage, and pregnancy anomalocation, hypertensive and maternal collapse disorders, small for gestational age, recurrent pregnancy loss, cord prolapse, obstetric cholestasis, thrombocytopenia, RBCs, antibodies, cardiac diseases with pregnancy. It's full scientific day. Preterm labor, psychological disorders, neurological disorders, breech presentation, ECV, nerve injuries, GPS, intrapartum care, instrumental delivery, cesarean section, VBAC, and Ogilvie syndrome, VTE, thromboprophylaxis, and ovarian vein thrombosis, breast cancer with pregnancy, bronchial asthma, appendicitis, twins, and skin eruptions, renal disorders, liquor disorders, amniocentesis, sickle cell disease and thalassemia, antepartum hemorrhage, and placenta previa and placenta accreta spectrum, postpartum hemorrhage, IOPD, abortion care, reduced fetal kicks, induction of labor, abdominal incisions, many talks are covered, antenatal care, teaching, thyroid, infertility, contraception on 2 scientific days, female genital mutilation, menopause, ovarian cyst, infections, whatever gynae or obstetric infections, and pelvic organ prolapse, laparoscopy, urogynae, endometriosis, inflammatory bowel and irritable bowel, endometrial hyperplasia, cancer cervix and cervical screening program, endometrial cancer, obesity, Essex, social hysteroscopy, abnormal uterine bleeding, sexual abuse, medical governance, vulval disorders, ovarian cancer, ergonomics in laparoscopy, sepsis, postmenopausal bleeding, thyroid and subfertility, and statistics in one full scientific day. These are some of the topics which will be discussed in this course, inshallah. And here also other topics, okay, will be discussed in the crash course. Some of them already repeated from the long course, and some other topics are new in the crash course. So our first step is the long course, very important. It's coming from NICE guideline, green top, dogs, PASH, Faculty of Sexual and Reproductive Health, BHIVA, ISHRI, and others, like Stratog. Then revision course. In every topic, there is an exam and there are quiz exams before the exam, inshallah. This is how my website looks like. Here you will find the PowerPoint, and here you will find the video recordings of our meetings. So here, there will be your only place to study from. You don't need to open any guidelines. It's a waste of time. The very important question I always ask it, hey, doctor, do I need to look to the guideline after studying the PowerPoint? I say, okay, you can do it, but inshallah, you will not find any missed information. So no need to waste your time on searching or downloading the guidelines. Here, how your panel on the website looks like. Here's the courses you are enrolled in, and it tells you how many and how much of the topics in this course you studied. So you know what you need to study. Okay, and here a screenshot from one of the meetings, and here how the quiz on the website looks like. You have a question and options, you choose until you finish, then it tells you what is your score and which questions you should have solved better. And here some feedback of my friends and the candidates of last courses. Okay, Alhamdulillah, the feedback from the last course and from the last exam, which was 3 days ago, it's very lovely. Alhamdulillah, most of the questions in the exam were solved in the course within the last weeks before the exam. Okay, I will not read these lovely feedbacks to save some time because I'm planning for scientific topic today, which will be vomiting post pregnancy, which is a green top guideline. Yes, I am ready for questions. You can open your mic and ask. Somebody has a question? You can ask on the mic or on the chat if you want. So it's clear so far? Okay, thanks, Dr. Samar. Okay. Let's start our scientific topic. Okay, the timetable for January 2023 exam is not published yet on RSOG website. My last time I checked it yesterday because there is already a coming exam in September. So they didn't publish the timetable for January so far. So mostly it will be published just around the timing of September exam. You can hear me well. January 2023 exam will be published on RSOG website within a couple of months, inshallah. The course itself will start next Friday, inshallah. You can hear me well, right? Next Friday, yes, inshallah. So after Eid al-Adha, happy feast for all of you. Don't worry, Dr. Raga, I will send on the group the video recording of this meeting. And also I will publish it on my Facebook page. Thank you. Do you need to pray Al-Jum'ah first? Because it's Jum'ah prayer in some countries now. Just to confirm, the session will be available offline afterwards if I cannot attend live. Okay, it's a good question. So as we said, your studying source will be only from my website. In the website, you will find the PowerPoint covering all topics, and you will find the video recordings of the meeting. Don't waste your time with guidelines. And you will have access to the website until January 2023 exam. Stratog or busy sparse? You don't need neither, Dr. Muhammad. You don't need neither. Okay. Okay, so already our schedule is light today, so we can take a break 2 hours to pray Al-Jum'ah. Then we start our second session to talk about hyperemesis gravidarum, inshallah, after 2 hours. Okay, usually in Friday we give a break 1 hour for praying Al-Jum'ah, but today already is Yom Arafah, كل سنة وانتم طيبين, so no problem. We'll make it 2 hours to avoid anybody miss الجمعة prayer إن شاء الله. After 2 hours I will send a new link for second session إن شاء الله. Thank you. السلام عليكم. See you again after 2 hours. Goodbye.